Tri-Valley Anti-Poverty Collaborative Program, navigating change, immigrant stories, challenges, and policy impacts. We're glad you're all here, and a big thank you to our speakers who have taken time from their incredibly busy schedules and to share their expertise and experience with us today. I'm going to jump right in, and I'm going to start off with Julia. And Julia Raifman, she's going to talk on regional understanding immigrant demographics and disparities. Julia Raifman, she's the Director of Community Assessment, Planning, and Evaluation for the Alameda County Public Health Department. Her team leads data analysis efforts to inform equitable public health practices. Julia brings a wealth of experience in health policy, having previously served as a professor at Boston University, where her research helped inform national legislation on housing and unemployment during the pandemic. Please help me welcome Julia.
Thank you. Thank you everyone for being here and for your support of immigrant health in the Tri-Valley area. It's a privilege to be with you this morning and talking about this important topic. The colors got a little bit off. I hope this will work for us. All right, so I have two objectives this morning with my presentation. So first, I want to reaffirm our commitment to supporting the health and well-being of immigrant communities in Alameda County and the Tri-Valley area. And second, I want to provide data to inform work supporting immigrant health and well-being in the Tri-Valley area. We are grateful for our immigrant populations who contribute to the vibrancy and diversity of our Alameda County community, and that all the newcomer individuals and families contribute to our community. The Tri-Valley immigrant population is shaped by a long and rich history. Alameda County sits on the ancestral homeland of the present-day Muwekma Ohlone tribe, who are also members of the historic federally recognized Rona Band of Alameda County, and descended from the many different tribal groups present in the Bay Area before Spanish colonization. After Spanish colonization, the current-day Tri-Valley area primarily became Spanish and later Mexican-owned ranch land. After U.S. statehood in 1848, the population of Alameda County and Bay Area grew during the gold rush, which drew mainly white and European immigrants. Despite the population growth in the larger Bay Area, the Tri-Valley remained rural throughout the 19th and mid-20th century. The area began to suburbanize in the 1950s, coinciding with the construction of the Lawrence Livermore National Laboratory. The construction of the laboratory and the later boom in the tech industry would begin to attract highly skilled workers to the Tri-Valley area. Latinx immigration to the U.S. increased in the mid-20th century due to the Bracero program bringing in Mexican immigrants to work in agricultural and industrial jobs. The Bracero program ended in the 1960s, but Latinx immigration continued throughout the 20th century. The Asian Exclusion Act of 1924 initially excluded Asian populations from immigrating to the United States. In the Immigration Act of 1965 removed restrictions on immigration. This coincided with the 1970s and onward seeing rapid suburban development in the Tri-Valley area as population of the Bay Area swelled and many moved further away from major urban cores such as Oakland and San Francisco. Events such as the Vietnam War in the 1970s led to waves of Southeast Asian refugee immigrants to the Bay Area, and many of these communities subsequently settled in the Tri-Valley area. A subsequent Immigration Act created the H-1B visa, allowing for people in specialty occupations to immigrate and work in the U.S. Many were actually recruited to come to the area. This allowed for a wave of primarily Asian immigrants employed in specialty fields to migrate to the U.S. As our history shapes our present, our whole coloring got off, but hopefully I can still see the key point. But as our history shapes our present, there are several structural factors that shape immigrant health and well-being in the Tri-Valley area. Workers from immigrant communities in Livermore disproportionately work in the service sector and agricultural jobs, which tend to have lower wages and tougher working conditions. According to community informant interviews conducted by the Public Health Department, many workers who work on ranches and vineyards live in crowded communal living spaces on site at their workplaces. The high cost of living and housing costs also pose a challenge. According to Zillow, the average rent in Livermore is $2,800 a month. Workers in low-wage industries or the service sector may struggle to make ends meet due to the high cost of living, which can also contribute to household overcrowding. The specter of immigration enforcement can hang over the heads of mixed-status families in Alameda County and the Tri-Valley area. Under the previous Trump administration, at the start of this administration, we've seen increased efforts to utilize federal law enforcement agencies to pursue immigrants, separate families, and disrupt communities. Anti-immigrant rhetoric and policies can lead to increased fear, stress, and anxiety in immigrant communities, which harms physical and mental health. Mixed-status families may also fear accessing health facilities due to the potential for contact with immigration enforcement. Our immigrant residents are disproportionately likely to be uninsured or to rely on public insurance expansions. Patients on Medi-Cal or without health insurance face limited access to providers, which can lead to delays in seeking care for chronic conditions or serious illness. And access to health care remains a major issue more broadly in the Tri-Valley region. The city of Livermore and portions of East Alameda County broadly lack access to some of the health and human services infrastructure relative to areas such as Hayward and Oakland. Alameda County has closed its WIC clinic in the area, and Kaiser's Livermore office does not offer urgent care or emergency services. And community partners in the region have noted residents in need of health care may have to go all the way to central county, such as Hayward and the Castro Valley, in order to receive urgent health care. Additionally, the prior Trump administration's efforts around shifting the definition of a public charge has led to a chilling effect that limits healthcare service use in immigrant households due to a fear that usage of healthcare or public benefits could negatively impact their chances of adjusting their immigration status in the future. These next slides describe the immigrant population, well, the full population, in the Tri-Valley area. This figure depicts the population by place of birth. So you can see that in the Tri-Valley area, as in much of Alameda County, about 1/3 of the population was born outside the United States. So here in Tri-Valley, 70% of the population was born in the United States, 12% in South Asia, 8% in East Asia, 3% in Europe and Southeast Asia, 2% in Mexico, and 1% in Middle East and Africa. This provides more granular detail on where people are from in the Tri-Valley area, with the number of immigrants living in the Tri-Valley area from each region. So you can see the major regions that I showed in the prior figure, and that people are from several other countries and regions of the world. This figure depicts the age distribution of people in the Tri-Valley area who were born in the U.S., who were born outside the U.S. and who are citizens, and who are born outside the U.S. and who are non-citizens. You can see that people who were born outside the U.S., especially those who are not citizens, are more likely to be aged 26 to 49. This is an age when many people are working, and also an age when many people have children in their households. We see that, I'm tempted to change the color from it. We see that immigrant populations are a very important part of households in the Tri-Valley area. 37% of households have a household member who is an immigrant. 13% of households have a household member who is an immigrant and not a citizen. That doesn't mean that they're necessarily undocumented, they have different visa types or so forth. When we look at households with children, 50% of households with children in the Tri-Valley area have a household member who's an immigrant. 22% of households with children have a household member who is an immigrant and not a citizen. Tri-Valley immigrants are also an important part of the workforce. 38% of Tri-Valley workers are immigrants, and 15% of Tri-Valley workers are immigrants who are not citizens. Undocumented immigrants also contribute to our economy, contributing nearly $8.5 billion in taxes in California and playing a crucial role in supporting public services. These are some socioeconomic data on the immigrant population in the Tri-Valley area. This figure depicts level of education for the population born in the U.S. people born outside the U.S. who are citizens, and people born outside the U.S. who are non-citizens. So you can see that people who are born outside the U.S. who are not citizens are more likely to have a bachelor's or higher level of education relative to people who were born in the United States. People who were born outside the U.S. who are citizens are a bit more likely to have high school education relative to people who were born in the U.S. This figure depicts the percent of the Tri Valley population living under different poverty levels by place of birth. And here you can see that a relatively similar proportion of people who are born in the U.S. and people born outside the U.S. live under 100% of the federal poverty level. A bit more people, a bit higher proportion of people born outside the U.S. who are not citizens live above the 200 or below 200% of the federal poverty level, and as well as below 300% of the poverty level. This figure depicts the rent burden, which is paying 30% or more of income per month on rent. And people who have high rent burden can face challenges having economic security and paying for other important items like having enough food and other services. So people born in the U.S. Are a bit more likely than people born outside the U.S. who are citizens to have high rent burden. People who are born outside the U.S. who are non-citizens have much higher rent burden relative to people born in the U.S. This figure depicts the percentage of people who are employed by place of birth. And you can see that a higher proportion of people born outside the U.S. who are citizens and non-citizens are employed relative to people born in the U.S. And this largely reflects the age distribution that many people born outside the U.S. who are living in the Tri-Valley area are of working age. We do see that there are important forces at play with immigrant health, as I referenced at the beginning. We do see evidence that Latinx people in states with more exclusionary immigration policy climates have worse mental health than participants in states with a less exclusionary policy climate, and that speaks to what might happen more broadly across the country as we're facing a more exclusionary policy climate at this time. We also see that detention of a parent or caregiver is associated with adverse mental health and developmental impacts among children in particular. While we do see that most health outcomes for our immigrant population look similar to the health outcomes for the population born in the United States, we do have a lot of concerns about mental distress in this time, and we are glad to be here talking about the importance of inclusion and structural supports for immigrant populations in the Tri-Valley area, and to be working on campaigns to support immigrant populations more broadly in terms of their rights and being able to live their lives as well as possible in the current context, and also in terms of mental health and making sure we're supporting one another and sharing that our immigrant community is very valued in Alameda County. So in summary, immigrants are an important part of the Alameda County and Tri-Valley community and the community contribution. Keeping immigrant families together is critical to child health and well-being. Structural inequities and exclusionary policies can shape inequities in immigrant health and well-being. And we can each make a difference by supporting our immigrant population. Thank you for being here this morning and engaging in this important conversation, and I welcome any questions.
Can you go back on those slides? Sure. I'm curious with the data. We spend a little time on that. Right there. So when you're talking about with education, bachelor's or more, are those people who are coming over like on work visas or?
Yeah, that's largely due to the H-1B6 program, and most likely that people who are skilled workers were able to immigrate and even recruited to immigrate to the United States.
So do you have that data broken out in a way where it shows the H1 outside of this information?
We don't have that, so we are relying on American Community Survey data. It's data that shows us some of the demographic information of people who live in the Tri-Valley area, who live in our county, but we don't necessarily have that type of facility located on.
Can you state what the federal poverty level amount is and the amount of family members?
That's a great question. I don't remember exactly what it is. I think it's about $30,000 if I'm remembering.
For a family of two, one?
Yeah, so that would be for one individual. So that would be $30,000.
The comparison is pretty spectacular. It looks like the immigrants outside the U.S. are doing okay in lower grades, and they really just dropped down in high school, but are back to really up there.
So this is the highest level of educational attainment for adults, and so this is kind of the distribution. So you can see that people who were born outside the U.S. or not citizens are they are less likely to have high school education, but they're more likely to have bachelor's or higher level of education, and the people who were born outside the U.S. who are citizens were more likely to end their education in high school. And I think, again, that reflects some of that history, actually at the beginning, and different immigrant populations who were recruited in different characteristics over time.
They're coming over for jobs.
But usually there's some correlation between leaving high school and getting college degree. This is the opposite.
I'm interested in whether they're schools. I think supporting immigrant households with children right now is of great importance as well, especially given that so many households with children do have immigrant family members and household members.
Again, is that data broken out at all by families with H-1 visas versus non-documented? Because, I live in a neighborhood where everybody's grandparents are there taking care of them, but the parents both work in tech. So it's not necessarily the ignorant people who are in trouble in this current administration.
Yeah, I think it's interesting because it's rapidly evolving context too, right? So people who were recruited to come here to be part of the skilled workforce on H-1B visas, and people who have green cards, people who have permanent residency, we're seeing them be targeted in ways that they haven't necessarily been targeted before, especially as there are stated objectives to have a higher level of deportation. And so, those families that have seen, the people that were recruited on skilled visas are people who have high levels of education, who we might think, no one's going to do anything to them. People are being deported based on traffic infractions or, from many years ago, or sometimes not necessarily even any infractions, or stated support for policy, international policies. And so, I think it is a different context. I also think, even when there are families who have citizenship, the children of immigrants and immigrants themselves are hearing the rhetoric, as are, as the increased hate crimes and things like that. So, the whole community hears that, and it can create anti-immigrant sentiment and action. And so that's partly why we're thinking about how can we support the mental health of the whole immigrant population. And there's not necessarily, like we think of, undocumented, documented, but there's kind of a whole spectrum of where people are in the immigration process and how long they live here. And the same people who, a couple of years ago were on a green card who may now be citizens. There's not a hard and fast line between them, but now we're seeing people who don't have citizenship are more vulnerable to changes in immigration policy.
You may have mentioned this in the beginning, so apologies if you did, but what percentage of the data is potentially missing due to undocumented folks not being counted?
Yeah, that's a good question. You know, I think it's hard to know what we can't see. You know, and it is participation in a survey that doesn't ask about whether people are undocumented. So, you know, at least people aren't asked to do that. But I would definitely think there's a chilling effect for participation in the survey among people who are not documented, like with the census.
I'm sorry, I apologize, but I can't really hear you because you speak in the microphone
Yeah.
and then you speak outside. Do you mind? I'm like a little hard of hearing.
Oh, I really appreciate your time.
Thank you,
Yeah.
thank you.
Thank you.
Thank you.
Forgive me for not knowing, but what does the public health, what are you seeing with the current situation? And are people coming to you, and are there services, are there ways for you to help people, you know, in crisis or approaching crisis, or how are you able to help?
Yeah, so I work on the data side of the public health department, and what I can share that we've done is basically in November we started planning for populations we anticipated might be impacted by changes in federal policies, and thinking about what we can do to be supportive of our population, and especially our vulnerable populations. And so we started pulling what data we can. You know, I think we do appreciate questions about what further data we can provide, and you know, and how we can use that to inform our programs and inform action in our community. And you know, the work is something that we are newly picking up in the last few months. And so I can plan that's what we've done on the data side. My colleagues who are surveying, doing direct service roles and leading direct service programs, you know, we are making sure that we don't collect any information on immigration status, and that people know that we are a trusted support. And we're doing what we can to help people learn about their rights. We have partnered with La Clinica to do a campaign to let people know about their rights as immigrant populations. And you know, and I think we're out speaking in community about the importance of supporting our immigrant populations. We are also developing a Messages of Care campaign for our immigrant population, as well as for LGBTQ populations and other populations that might be affected by increases in hateful rhetoric or policies.
Hi, Molly Wolf is here. We're from the Public Health Department. Just wanted to answer your question. The Board of Supervisors Committee also has put together an ad hoc advisory committees. They meet twice monthly, and they put aside a special chunk of money as well to combat some of the misinformation and support of nonprofits and other organizations that work with immigrants. That's one of the things that Julia mentioned.
Wonderful, thank you.
Maybe you could give us a little bit more background and why specifically are we seeing like a higher and worse mental health outcomes amongst our Latinx Hispanic population?
We see that the policies really shape mental health, and that when people are of any different population are targeted by like increased stigma and hate, that really takes a toll, especially on youth. Like youth always have more experience of mental distress. You know, it's a developmental period when people are more vulnerable to mental distress, suicide attempts, and considering suicide. And we do see that that when there is increased rhetoric or increased policy targeting vulnerable populations, whether that's immigrant populations or whether that's LGBTQ populations, we see that mental distress increases, especially among adolescents, when there is that kind of policy change. So that's what some of those studies reference. You know, and then I think the direct impacts of young children and youth, you know, being concerned or actually experiencing separation of families. And then, of course, that's extremely detrimental to child development and to the whole family's mental and physical well-being.
Could you say a little bit more about the messages of care? What does that entail? What does that look like?
Yeah, so that's currently under development, and what we're doing is we are, as a public health department, partnering with our colleagues who have expertise in developing messaging campaigns, and then we're working with the populations that we're seeking to support, and sharing draft messages with them for feedback, before then sharing them through social media and out in the community. We'll be glad to share those with you as we develop them. The first slide that I showed as well, that is from our Alameda County Behavioral Health Division. You know, this is something that is developed in January, just making sure that we're stating that all are welcome in our county and that we value the diversity of our shared community. And I think doing what we can to get the word out. That's how we are supporting our population.
Thank you.
Along with that question, will you be providing resources with this care message?
That's a great question. So we, right now, we have actually been looking into different hotlines. The 988 number that has been the suicide prevention hotline go-to, that's managed by the federal government. And so we are working on providing local alternatives that might be a more trusted source at this time.
That kind of dovetails with my question, which is that I know this is state, however, federal funding is changing, and I'm guessing that that's got to have an effect on you all to some degree. What are you seeing as far as that goes, and is there a way to bridge gaps and monies?
Yeah, I think only the federal government has the capacity to fund public health programs and many programs that drive structural drivers of health, like Head Start, like food assistance, SNAP, WIC. If only the federal government really has the capacity to fund these at the scale that is needed, certainly we will do what we can to encourage state and local government to support important programs that are affected by the federal government, but really doing all that we can to support the federal government and continuing to fund programs or considering reversing programs that have been cut. Reversing the cuts that have been made. I think we're seeing that will play an important role. Similarly with public health programs, right? Like programs to control communicable diseases like measles, like HIV. Federal funding plays a very important role here in the county and across the country. And of course, what happens with communicable disease isn't just a matter of what happens in our county. What happens in Texas affects the whole country. Yes.
Thank you so much. All right, and we'll just keep moving along. We got a lot to get through. So our next presentation is Lydia Sinkus, who will speak on understanding immigration rights in the deportation process. Lydia is a deportation defense attorney with Alameda County Public Defender's Office. She spent over 7 years working at the intersection of immigration and criminal law, previously serving at JFCS East Bay. Don't know what that is, but maybe she'll tell us. Lydia has represented both detained and non-detained clients in immigration court, federal court, and before the Board of Immigration Appeals. She's a graduate of Berkeley Law and clerked for the U.S. District Court in Washington State. And let's welcome Lydia.
Thank you. Please let me know. Can everyone hear me? I'm going to try to remember to hold the mic up, but you can yell at me if you can't hear me. Oh, that's okay. Let's see. here I am. I'm Lydia Sinkus. I'm from the Alameda County Public Defender's Office Immigration Team. And I'm here to talk to you today about some of the processes that are involved in immigration enforcement and also state and local policies and things that we can do to support our immigrant populations. I think we got a pretty good idea of the role that immigrants play in our community from the last presentation, some more in-depth data, but a big part of our county community is an immigrant population that is really integral, right, to our economic and social fabric here in the county. And we have seen increasing fear and anxiety and stress about family separation, deportation, detention. And we know, and we just heard, that this has really significant health impacts and societal impacts. And at the Public Defender, we don't believe that separating families, causing distress, removing breadwinners, we don't believe that that makes our community safer. So I'm hopefully here to share some information with you guys today that can provide tools to help you feel more prepared to support our community. So we're gonna start off talking about the federal deportation system and just do an overview, right, of what are we looking at when we're talking about deportation, detention, how do these systems work? So really basic, what is deportation? Deportation is the forced removal from the US of someone who's been found to violate immigration laws. So deportation involves necessarily someone being forced to leave who maybe is not ready to leave or does not want to leave. Who is doing the deporting? So we have immigration courts that are often involved in deportations, and those courts are housed under the Department of Justice. These are administrative courts, the Executive Office of Immigration Review. And then we have ICE prosecutors who are attorneys who are involved in bringing deportation proceedings, and they are housed under the Department of Homeland Security. And then we also, not on the screen, but outside of that system, we have regular ICE enforcement who can sometimes deport people without going to court. So the thing to notice here is that both of these departments, the court and the prosecutor, are housed under the executive branch, so they have the same boss, right, the president. So this is one reason why when there's a change in administration, we see such a big impact in policies around deportation. So let's talk a little bit about the process by which people are deported. Often it looks like removal proceedings. So these are court proceedings where an immigration judge decides whether a person can or should be deported. Deportation comes in two steps. First, there's a legal process where someone receives a legal order of deportation, and then there's actually the physical deportation. So this doesn't always happen at the same time, and it doesn't always both happen, so we'll talk about that a little bit. For people who do go through this process in immigration court, there is an appeals process, right? So we appeal up to the Board of Immigration Appeals and then eventually up to a circuit court. So it is a legal process that can take sometimes years, sometimes 12 years, it can take a lot of years. But not every person who's facing deportation gets to go before an immigration judge. There are certain scenarios where someone can be just deported without going through this legal process. At the same time, not everyone who is put in deportation proceedings or in removal proceedings is actually deported. So there are two steps when someone goes through this immigration court process. First, the judge has to determine whether the person has actually violated an immigration law. Are they actually deportable or removable? And even if a person has violated an immigration law, oftentimes they might be eligible for some sort of what we call immigration relief. So just because a person is found to have violated immigration law doesn't mean that they're necessarily going to be deported or that they can't obtain legal status. We often see people violating an immigration law of coming to the United States without documents and then applying for asylum, which is a legal status and is a legal pathway to gain status. We also see people who can apply for something called cancellation of removal based on time in the U.S. and having U.S. citizen children or parents or family here. We also see people who apply for family visas and get those visas. So the prior speaker talked a little bit about kind of the fluidity of legal status, and that's something that we see often within immigration proceedings. Just because someone is put in removal proceedings doesn't mean that they will necessarily be deported. They might have a very clear pathway to legal status in the country. But not everyone who is going through this process gets a lawyer. And we see the outcomes vary quite significantly if someone has a lawyer or doesn't have a lawyer, because immigration law is very complicated. And this process can be a very difficult process to go through. So if a person is in immigration proceedings, they have the right to a lawyer. They can ask an immigration judge for time to find a lawyer. But it can be really expensive and really hard to find a lawyer. And unlike in criminal proceedings, when the county will give you a lawyer, that doesn't happen in immigration proceedings. So we have a lot of people going through this process without legal representation, which is something that our office, we are inserting ourselves to provide that representation for people when possible. So if someone is going through this court process and they lose their case, they don't win relief, they're removable, what happens? Typically they will get what's called a deportation order or a removal order. So again, this is not the same thing as being deported or removed. There are a lot of people who end up with a removal order but who stay in the United States for various reasons. Some countries won't accept people back, although we are seeing now this administration is pressuring some of these countries called recalcitrant countries to accept people back. So we have people who have been in the US for 20 years with a removal order because they couldn't be deported to their home country. And now we're seeing a lot of increased fear in a lot of these communities, a lot of Southeast Asian communities, that they might be able to be deported with that order because their country might be pressured to take them back. We also see people with removal orders who can't be deported because if they are deported to their home country or their country of origin, they risk torture or other physical harm there. So those people oftentimes they get a removal order and then they have to check in with ICE every year, and they have a work permit and just living a normal life in that situation. And something that we're seeing now is an attempt to send those people to a different country that's not their country of origin, so like a third country. So that's kind of another thing that's been disrupting the normal process of how we see people come out of removal proceedings. And then we have some people who have a removal order and just haven't left. And they are here with what's called an unexecuted removal order, and they can be picked up off the street by ICE anytime and deported. So that's kind of the arc of the process of removal through the immigration court process. I think for someone, not everyone knows whether or not they've been put in removal proceedings, which is kind of interesting. People get documents from immigration in various ways and they don't really know what they are. So I think it's important for us to know how to help someone find out whether they're not they're in removal proceedings. And what's really important to that is an A number. So an A number or an alien number is the number that's assigned to an immigration case from the first contact with immigration authorities. And that number follows a person all the way through to citizenship. It's important for people to know their A numbers, to have a family member that knows their A numbers, because if anything happens, that's how you can find a person, that's how you can track a person through the system. And this will show up on really like any documents that a person has from immigration. there is an online system and then also a phone number that folks can call. I think this is pretty important for people working with immigrant communities, non-citizen communities. If people have had an interaction with immigration and they don't know whether or not they have a court case, it's important to know, because if a person has a court case and doesn't know and doesn't show up, they can be ordered deported just for not showing up. So this case portal or this phone number, someone can call, you put in the A number, and it will tell you whether or not someone has a case pending, when their next hearing is. You know, honestly, I think for a lot of people that don't have an attorney, keeping track of when their hearings are can be really difficult. There's a lot of changes. These cases last for years. So I think this is a really important resource to be able to help people know what's going on in their cases. So some people who go through a deportation process are taken into ICE custody, and I think there's a lot of fear now in at least the communities that I serve of people of whether or not they're going to be detained by ICE. Immigration detention is, looks like I'm missing a slide, that's okay. So immigration detention is civil custody, right? So it's very different from criminal custody. It's a civil incarceration of people who are accused of violating immigration laws. And people who are in immigration custody are usually in removal proceedings, or they're appealing their case, or they're waiting to be removed. And people can spend 6 months to like 3 years in ICE custody, oftentimes not knowing when they're gonna get out. In Alameda County, for the residents of our county, they are usually sent to Southern California to immigration detention. We don't have a detention center up here anymore with a contract with ICE, and so folks are sent very far from their families. And all of the representation that we do for Alameda County residents is virtual. So over Zoom, I don't meet a lot of my clients, but that can be really hard for people to be so far from their families. And you know, in criminal proceedings, you expect that someone could maybe get bail, and a judge could order for them to carry out their case outside of detention. In immigration custody, not everyone gets a bail hearing. A judge can grant some people bail and let them pursue their case outside of custody. But some people are subject to what's called mandatory detention. And that means that a judge can't review their case to decide whether or not it makes sense for them to stay in custody while they go through the immigration process. Which is just a really unusual scenario, right, compared to like the criminal system. And this mandatory detention is based on any contact with the criminal system. It used to be that I could say it's based on like having certain convictions, and oftentimes really low-level non-violent convictions. For example, someone with a possession of drug paraphernalia conviction would be subject to mandatory detention and have to stay in detention throughout their whole process. This year, a new law passed that subjects people to mandatory immigration detention for having an arrest or a certain charge without a conviction. So this impacts a lot of people. A person who is arrested for shoplifting and is put in deportation proceedings would have to go through their whole process in immigration detention, even if it's just an arrest. So we're just seeing more people potentially subject to this detention. So who can be deported, who can be detained? I think there's like a narrative that only people who are here legally can be put in proceedings or detained. And this is a myth, right? So the media focuses a lot on people who are illegal, but non-citizens could be green card holders, visa holders, asylees, veterans. We're seeing students having their visas revoked and being detained. Children can be put in immigration detention and deportation proceedings. So really anyone who's not a US citizen can be or detained. So here's just another tool. If someone in your community, someone that you serve, is picked up by ICE and a family needs to find them, there is this resource. Immigration has an online locator system where you use someone's A number and country of origin or name to find them. It's not always accurate. I have a client in custody right now who doesn't appear in the system. So just because a person isn't here doesn't mean that ICE does not have them, but it can at least maybe help you know where they're detained, try to get in contact with them. So just really quickly, we've seen a lot of changes recently in how these systems work. The processes are getting more complicated. There's rapid changes with the executive orders and whether or not they're going to be overturned or upheld. Some things that I think really impact us as service providers is that we're seeing increased monitoring by ICE of folks. People are being called in for check-ins. My clients used to have a check-in once a year. I have check-ins now every 6 months or every 3 months. So they have to take the day off work, they have to find childcare, they have to go to the city, and they have to hope that they're not going to be detained when they go, which is an incredibly nerve-wracking experience. But it's important that they keep checking with ICE so that they're in compliance with all of their requirements. And we're seeing arrests by ICE in places that we haven't really seen them as much before. Outside people's homes, at work sites, at courts. This is just causing like a lot of anxiety for folks, right? Because they don't really know what to expect. And we've seen more people being detained, and we've seen clients who are giving up actual claims for immigration relief because they're detained. And ICE detention has always been pretty dangerous. The conditions are not always, they're usually not very good. But now, folks don't know if they're going to be deported to another country. So we have seen people give up a chance to stay in the U.S. just because of being placed in ICE custody. So that's kind of at the federal level. Locally, how does our state and local policy interact with these federal policies? A lot of times we talk about like a sanctuary state or a sanctuary city. And I think there can be some confusion about what that means exactly. It can mean a lot of different things. It doesn't mean that a person who lives in that state or county can't be deported. And when people talk about California as a sanctuary state, they're often talking about SB 54, which is the California Values Act. And this is a state law that limits cooperation between local and state law enforcement with ICE. So it limits how state and local resources can be used to investigate, detain, or notify ICE about people who might be non-citizens. And really the goal of this law, right, is to have trust between our communities and our local law enforcement. We also often see this talked about in immigration and ICE holds. So this is a big part of SB 54. It sets rules about what local and state law enforcement, how long they can hold someone for ICE. So ICE will sometimes issue an ICE hold and ask a local jail to hold someone in custody after they've already been released, so up to 48 hours. And these holds aren't mandatory. Local agencies, the local sheriff, can really choose whether or not to comply up to a certain point. And then SB 54 kind of sets limitations on this, but there are a lot of exceptions, right? Like jails can still cooperate in certain circumstances, and there are a lot of people who are still left unprotected. And this level of cooperation really comes down to county advocacy, and we'll talk about that a little bit in the next slide. But it's important for us to remember that just because someone has an ICE detainer, it doesn't necessarily mean they'll be deported. It means they might be picked up by ICE when they're released from criminal custody. It means they might be placed in removal proceedings, but we need to continue connecting these people with resources because they still have, we'll get to go through the process that we talked about. So on the local level, right, we often hear about sanctuary cities, sanctuary counties. And again, it doesn't mean the person who lives there can't be deported, right? And it can mean a lot of different things. It's often a value statement, and sometimes not much more than that. It sometimes it restricts how government agencies ask about immigration status. For example, our local health department not asking folks about immigration status. It can speak to funding priorities, and then oftentimes can speak to the contact between local and federal authorities. So, for example, in Alameda County, the sheriff has said that she won't comply with ICE holds, she won't share release dates, she won't share information about people in jail with ICE. She will limit access of ICE to jails unless she's required by law or by a judicial warrant. So like a lot of our local advocacy around this is with the sheriff and other local law enforcement to talk to them about how we want our local resources to be used. We want them to be used on public safety locally, or we want them to be used on federal enforcement. So we've talked about the federal system, we've talked about state, local systems. What can we do as a community to help with emergency planning for people that we serve? So these are just some really concrete things that we tell all of our clients. We hope that people in the community can learn. So it's important to memorize a phone number of a friend, a family member. If someone gets picked up by ICE, it's good for them to have a phone number that they can call. If folks have an attorney, a family member or a friend should also know how to contact their attorney, because someone in ICE custody might not be able to do that. It's important to keep documents in a safe place, a safe, accessible place where a trusted friend or family member can get to them. For example, birth certificates, immigration records, evidence that someone has lived here for a long time, and have those accessible. Folks can make sure that a loved one knows how to locate them if they're detained by ICE, so sharing the information about the detainee tracker, and make sure that someone knows your A number, right, so that they can look you up. I know that, for a lot of folks, it's a hard economic time and resources already limited. We do tell certain people that maybe they should start saving for a bond fund if they think that they're at risk of being detained by ICE, because you don't want to have that be the thing that keeps you in ICE detention. And bonds can range from $3,000 to $12,000, so it can be quite a lot of money to get out of immigration detention. And then it's really important for people to know their rights and to understand their specific situations, so folks can get consults so that they know what their individual risk is and they know how they individually can prepare. That's something that is important right now. And then for families, we talked a lot about mixed status families, and that's, I think, a concern for a lot of people in our community. If someone is at risk of deportation or detention and they have children, they should create a plan to make sure that their children can be cared for if they're picked up by ICE. Put a power of attorney in place. If someone is afraid that they might be deported, it could be a good idea to get passports for their kids so their kids could follow them if necessary, because that can get really messy if a parent's deported and the kid doesn't have a passport. And then ILRC has, the Immigrant Legal Resource Center is a great resource. They have a really good family preparedness guide. Obviously this link doesn't work because it's a PowerPoint, but if you Google this information, they have a really, really great guide in multiple languages for families. And then here in Alameda County, we have the Alameda County Immigration Legal Education Partnership. And this is it's a collaborative, I guess you would say, that has restarted recently. And it provides services to families, non-citizens with ties to Alameda County. So if someone is facing imminent risk of arrest by ICE or is in detention, they connect with those folks and give them support. They can offer consultations and pro se legal assistance. So they can't give you an attorney, but they can help folks out if they have an upcoming hearing, or if they, and they don't have legal representation. Then they can help people prepare for check-ins. If someone has an order of removal and has an upcoming check-in, it can be really unclear about what's going to happen at that check-in, if they're going to be detained and deported, or if they're going to be just allowed to go home that day. So they can help folks prepare for that. And here is the hotline number. So they also, they take calls if someone sees ICE activity and wants to report it. If someone is picked up by ICE and you don't know who to call, you can call this number, and they can kind of help orient family members a little bit. And they have a lot of great materials. I would recommend checking out their website because they have a lot of really good Know Your Rights materials as well. And other counties do have rapid response hotlines and networks, so I've just put the numbers up here. And really it's kind of a county by county response, so residents of a certain county should call the hotline for the county that they live in.
Can you go back for just a moment?
Yeah, this one or the one before?
Before. Thank you so much.
Yeah. Okay. Then I'm going to put another one up. So this is the Alameda County Public Defender line, and I'll just close by letting you guys know who we are able to provide services for. So if someone from Alameda County is detained by ICE, please call us. We try to take on representation of anyone from our county in ICE custody because that is a really urgent and difficult situation. If someone has an immigration case and is not in ICE custody, we typically represent folks who are already clients of our office, just because of the limited resources that we have. But that is the number to call if someone wants to see if we might be able to provide representation or services. And then my email for any questions. I don't know, I think I've about hit my time, but I don't know if there's time for a couple questions.
Wondering if you could tell us the current status on ICE's push to use the federal facility in Dublin as a detention center. I know that you're county and that's federal, but maybe you can speak to that.
Yes, thank you. That's a good question. So ICE used to have a contract with a detention facility in Dublin, and there were folks detained there. I know that it's like currently there's a contract in negotiation. I don't know much more than that. I know that the sheriff has said that they have been approached by ICE to lease space and have said no, but since this is a federal facility, right, it's a little bit out of local control. I know that there was a protest against it in the past month, so there is organizing and local movement towards not having that contract put in place, but I don't know the current status. It's kind of an opaque process, to be honest. But I'm sorry, I don't have more information about that.
Yeah, I'm curious, you talked about the check-ins and how stressful that is. And I'm just curious, what happens at these check-ins?
Thank you, that's a good question. So I just went with a client to one last week. And so we go to an ICE office. The one that I usually go to is in San Francisco, in the federal ICE building in San Francisco. And you wait in a long line outside on the day that you're told that you have to come check in. And you go inside, and we waited for like an hour and a half outside last week. And go inside, and you're asked for your paperwork, which just has like your name and your address and your check-in date. And they ask you some questions. Maybe they ask you about your current case status, how it's going. And either they say, we are going to re-detain you, or they say, come back in 6 months. So it's really stressful. When I go with clients, it's because there's a higher risk of them being re-detained, and really there's nothing that I could do being there to stop it, but to have someone to accompany them. We often tell folks to have a family member go with them who has status, because if they are detained, someone should know that they've been re-detained. And yeah, even like if someone doesn't know that they're going to be detained, it's like the clothes that they wear to their ICE check-in, if they're deported eventually, will be the clothes that they're deported in, right? So it's just a very stressful experience. I think for some people who've been checking in for a really long time, this is why I think individual consultations are really important, because some people have a really low risk of redetention at their check-ins, and then other people, because of their situation, have a higher risk. But we always advise people to go to their check-ins, because if they don't, then they've absconded and then ICE can come look for them.
You talked about this cancellation of a removal, and it could be based on the fact you've been in the U.S. Is that an arbitrary thing, or is it set back? And I'm particularly thinking about how does that apply to DACA kids?
Yeah, so there are really specific requirements for cancellation of removal depending on whether you're a green card holder or not. So it's like 7 or 10 years, and you have to have a U.S. citizen or a permanent resident, child, spouse, or parent, and that person you have to show that that person would suffer a very extreme hardship if you're deported. So there's very specific rules around it, and it's a defense. If you're in removal proceedings, it's a defense to being deported. You can't just like apply for it. So if someone with DACA, if they were placed in removal proceedings, or if their DACA was removed, if they had a qualifying relative, like if they were caring for an aging parent who was a resident, perhaps they could apply for it. So it's not, I think a lot of people think, but like it can be called like, oh, 10-year, like, oh, if I've been here for 10 years, I can get this, but there's a lot of other requirements to be able to get it.
You mentioned that this process takes a very long time. From your perspective, what would be the one thing that could be done in our immigration system to change or expedite or, improve what's happening?
From my perspective, a lot of the cases that I see and work on, I don't think need to be litigated as aggressively as they are by the government. Like a lot of time and resources is spent in removal proceedings for people who like have a pretty good reason to be here, a case to be here. And under the current administration, I think a lot of the delay is obstructionism, like the government appealing everything, fighting everything. I think, 10 years ago we saw more of the government attorneys agreeing to things and not fighting everything. So that's something that could be changed in the executive branch. I think obviously our immigration laws need to be changed, but that's Congress.
How many attorneys at the public defender represent? I'm assuming it's not everybody. Like, how many are available to represent clients that are in detention?
Yeah, I think that's a great question. So we have our immigration team is 3 removal defense attorneys, a federal litigation attorney, so there's 5 of us right now, and we just got funding approved yesterday from the Board of Supervisors to hire additional attorneys, which is really exciting and a great thing about being in Alameda County, which wants to support our immigrant communities.
Do you guys have a list of other attorneys? Because I am under the impression that immigration attorneys are all kind of shady and charge a lot of money. And I don't mean you guys, I mean private practice. I think that that's something that's very common. Give me $15,000 when they get your green card, and it never happens, stuff like that. Do you guys have other resources apart from the public defender or attorneys that you are familiar with, maybe working with, or would recommend, anything like that?
I have a list of nonprofits that serve Alameda County. Some of those nonprofits have a list of trusted private practitioners. It can be, you start recommending people. But some of those nonprofits have a list, and you bring up such an important point. So many people come to me and are like, oh, I paid this person. They told me they were an attorney. They weren't even an attorney. So something to be really aware of is notario fraud, right? Folks who say that they're a notario, which could be an attorney in Spanish, but does not here, and really get money taken, their cases get ruined. So I have a list of county nonprofits, and they might have more. And if there's a way for me to share that, I can share that. Yeah. I saw a question.
Well, I had a comment first. It was interesting, all of your slides. I just saw the Oscar nominated documentary short. It's Alien, but it's A-space Alien. I don't know if you've seen it. It's a hard watch. You can see it on YouTube, but it's very well done, and it's literally coming to life, what you were But my question is kind of related to the last one, which is, at what point are you, with all the policy changes and escalation, going to be so overwhelmed that you cannot take on all the cases that come your way? Or do you feel that way already?
We already have a waiting list. It's going to be so great to have additional attorneys. I'm really excited about that. And specifically, you know, folks to also help us like serve our immigrant youth who, you know, our office serves. That'll be really exciting. Right now, you know, I'm going to give you a nonprofit list, but everyone's at capacity, right? So I just tell people to get on a waiting list. If they're not detained, their case can take years, and maybe they'll get off the waiting list. But yeah, we're already at capacity, and a lot of the nonprofits received federal funding that has been cut. So, like specifically, nonprofits that serve immigrant youth have received huge cuts. So, we're already there, unfortunately. Here on
Is there any space for volunteer work? Like, I mean, you know, could you use a gopher, or is it all you have to be qualified?
Something that I was thinking about when I was putting this together is like maybe folks who could help like go with people to their check-ins would be such a good volunteer opportunity. I think maybe the way to into that would be through ASLIP, and they've just kind of started up again. But I maybe like contacting them would be a way for volunteer involvement, because I do think there are that accompaniment piece, I think, is a good place to get involved.
This is more of a comment. I have a bunch of red cards. We're mentioning Know Your Rights, so if I have them in Spanish, if you know people that would use them, come find me. I'm happy to pass them out. Basically, it's a red card that people can have. It says what their rights are in Spanish, and on the other side is in English. So if they are, encountered with ICE, they can pass this card to them. It says their rights. They don't need to memorize it. So I have some of those. I've also put together a toolkit for nonprofits. So if you guys want that information, I can take your email and I will send that out to you as well. And one last thing about this hotline, just to note, the hotline isn't to call for information. It's only if you see ICE in the area. So I just wanted to mention that, not to like tie up that line and keep it open in case people do see ICE in their area.
Thank you. There's a couple more questions. Should we save them for the end?
Yeah, no, I'm torn. Do one more question and then we'll table the rest of the end.
Okay, sorry, just going here.
Hi, a friend of mine just got a letter to self-deport. Is that a current thing? From ICE?
DHS has created an app for people to self-deport. They should go talk to an attorney.
Yeah, he has an attorney, so.
Yeah. Yes.
Thank you very much.
Well, we'll have a few more questions at the end, but now I'm going to invite our panel up. It's going to take just a second. We'll start off with some questions, and then we'll open it up for discussion as well. And here we have, over on the far right, we have Miss Regina Garcia from CAPE Head Start. Let me find her my little facts. Where are my facts on you, Regina? Regina is the Executive Director of CAPE Inc., which provides early childhood education and family support services to low-income families in Alameda County. Regina has over 20 years of experience with CAPE, advancing from site supervisor to executive leadership, and continues to champion diversity, collaboration, and holistic family care. So welcome, Regina. And then we have, here we have John Boast, and John is the Executive Director of Open Heart Kitchen. Since joining in 2023, John has launched several key initiatives. I don't think he has slept yet, including the Vineyard Resource Center, a permanent supportive housing site with wraparound services, and the Open Heart Kitchen Food Bank, the Tri-Valley's first major food distribution hub. And I'm trying to find Vivian. Vivian Pham is the CEO of Abode Services. This is one of the Bay Area's largest and most effective homelessness response organizations. Over 18 years with Abode, she has led its expansion from serving 1,000 people annually to over 17,000 through strategic partnerships, sustainable housing models, and data-driven solutions. So please help me welcome our panel. already stepped in our board chair.
Well, I just want to say thank you for being here, and thank you to our speakers that were here this morning. It's a very volatile time, to say the least, and so we know that this is, we've got a lot going on. You're all working overtime, plus, and so we really appreciate you taking the time to be here today, so thank you. So we're hoping to make this more of a conversation instead of everybody, walking down, but, so I'm just going to throw out a question, and we'll just go from there. So what's one thing you wish more people understood about the immigrant families you serve?
Okay, well for CAPE, we've been providing services in the Tri-Valley. This is our 59th year. And so I think for me, I know I'm speaking to the choir here, but I would like people to know that the immigrant families that we serve are working families. That we are not just handing out free stuff. That our families are working in high need of childcare, of comprehensive services that we provide. I think for me that's the most important thing that I would like people to know, that we are providing for the working poor. And it's not just immigrant families, but the working poor of the Tri-Valley as well.
I think what, again, speaking to the choir converted, whatever I think that we're all together here. We're a housing organization, right? And I would imagine that many of you, all of you, struggle with housing in some way, or know someone who has, because it's a really expensive place to live in the Valley, in Alameda County, in the Greater Bay Area. So our immigrant families, particularly our low-income immigrant families, because the first presentation was really interesting in that we have sort of an immigrant have and have not community, right? And a lot of the, this really applies to the have-nots, and often that is separated into the deserving and the undeserving. But, as my co-panelist said here, that, our immigrant communities are working hard. They're trying to survive like the rest of us, and they have about 25 other barriers on top of a really harsh housing economy and stagnant wages and all of the things that we all experience. They have burden upon burden upon burden in an already hostile environment to live.
Can you name a few of those burdens?
So, burden of, fear, right? Fear, mental health, challenges, education gaps, right? That folks are targeted. I could talk more about homeless data, but the Latinx community is 3 to 4 times overrepresented in the homeless population, meaning looking at the census and then looking at who's actually homeless. 3 to 4 times more people in the Latinx community are homeless. That says that our structural factors are failing them, and that's many, many, many families, kids, and single adults as well.
I just also want to make a comment about preaching to the choir. Kathy and I have this conversation all the time, and you're all here because this is an important issue for you. And so you are part of the choir, but we're all here because we need to make our voices louder so that we can expand our choir and that we can bring more people into the conversation. So you being here is part of the reason that we can all make better choices down the line, and that we can bring more people into the fold and more people into our choir. So.
You're all singers.
Yeah, I'm honored to be with the two of you. I don't feel that I'm an expert in this, but I do get to meet some amazing folks. Is this working? That's up there? Up there? Yeah, so we serve working families, and as you said, folks that are already dealing with the complexity of living in the Bay Area have these additional barriers and burdens placed on them. I'll try to keep my head turned this way here. I think what's unique is, even though we talk about immigrant families as a monolith, they're not. They do come from different parts of the world. They have different stories. Surprisingly, they're all human beings. And so I think, just the culmination of these things, we see individuals and families who are just trying to do what everyone else is doing, who are human as well, what you provide for their families, and hopefully create a better life for their kids, and maybe they haven't growing up. So.
When you talk about families, how many do you feel are people with young children versus a family might be with older children, or just two adults together? Because I know family can mean not just children. Just kind of what's your perspective on that, with children and the families versus older?
For us, you know, our families that we serve, you know, they all have young children. We serve families with children 0 to 5. But it's also, you know, siblings. You know, we've had a wonderful partnership with the school districts here in the Tri-Valley, you know, being able to house us and have our classrooms on campus. But, you know, all of our work is with children, you know, so it's you know, the immigrant population that we serve, it's very impactful. And, you know, that's why we try to provide as many comprehensive services as possible, you know, for them.
And the reason I ask this is because when we did the needs assessment, one of the things that was a gut punch to me was mental health for our teenagers and our young adults. And so if you could kind of talk about a little bit about that too.
So I'm going to go to your first question, and I have a little bit of mental health. You know, first, you know, I almost said in the first go around is that we are all connected, right? So what is family? So I actually push back against the idea that family is defined by having minor children, right? We all, you know, in our work, we often talk about, you know, everyone needing somewhere to live, someone to love, and something to do. That's sort of who we are as human beings. That's how we gain fulfillment. So we all have family, whether it's your best friend, whether it's your sibling, whether it's your parent, whether it's 5 children at home. So, you know, and the homeless population shows up a little differently, frankly, because people are more willing to take in the single mom with the kids, so they're not hitting the streets and the cars as quickly as our single adults who have lost connection over time. So it really depends. As our first speaker said, really mental health among children and adolescents, and I mean, it goes earlier and earlier and earlier now because they are feeling the trauma of this otherness that we're putting out in the world. That this is who we should be and you are the other and I am out to get you. Children feel that in a real way. And our schools and our mental health system is not prepared for the wave that we already felt with COVID and the separation and that sort of singularity, this like growing gap of disparity. So this is really impactful to our immigrant communities, plus all of the other social media, all of the other crazinesses within our world. Please tell me if you can't hear me. It feels like it's going in and out.
You just have to hold it up really close.
It's like this.
Yeah, so I would say, I mean, Open Heart Kitchen is really a basic human needs social safety net organization. We've become more and more of a bridge organization at Vineyard, just helping coordinate resources and services among our trusted partners. So I feel like because we're doing those basic meet people where they are pieces of the puzzle, we can then connect them with the organizations like yours that are doing these deeper level conversations so we can move forward. And one thing I do think it's interesting that at Vineyard, which is located in Livermore, at the nexus of the 2 most economically impacted communities in all of the Tri-Valley, the number of families that stack in homes around this facility, where you may have a 2-bedroom, 1-bath house, but have 3 or 4 families living in there. And I know we're now saying we're counting this as house, right? Which is a whole other conversation, but yeah, just that cradle to grave kind of connection that people need for services from start to beginning.
Regina, can you talk about, has your attendance in your schools changed in the last few months?
You know, definitely we have seen a decrease in enrollment. And the really sad part is that our families want to attend, but now they're frightened. And they don't want to bring their children to school, you know, where, you know, that's where we need them to be. And that's probably the safest place for them. But it's been, you know, a difficult struggle. We do a lot of calling, seeing where the children are at. This is just our normal procedure, but even stepped it up even more now. We want to know where they're at, why they're now at school. So it's a very unfortunate situation, and going back to the mental health part, the things that keep me up at night are, definitely what is this fear doing to our children that we're serving. They're very young children in very formative years of their life, and their parents are very stressed and scared, and as we all know, that trickles down. That definitely trickles down to them. So yes, enrollment has been an issue for us, with our immigrant families, and it just, we try to call, get them back, and they do come back. We have a lot of safety nets in place, but it's difficult for them.
You have about nine locations?
Yes.
And how many kids approximately?
About 300.
And can I just ask also about the school districts? How are they handling all of this?
So the school districts have, definitely shared their emergency plans. We are on the call list if I shows up, anything like that. But they have been, they are supportive. The school districts have been supportive, to CAPE, which they've always been before this administration. In the last administration, they always include us, and we're very, very happy about that. Because without them, we wouldn't know what was going on. So they are always, and we're a feeder for the school districts. The children that we serve, we collaborate closely with the kindergarten teachers and the special ed teachers, to make sure that our children are in there to attend those schools.
So can you share a collaboration or partnership that has significantly improved your ability to support immigrants in our communities?
Yeah, I'm actually going to point to our faith communities have been really helpful. So in housing world, a lot of it is federal, right? It always has been, right? It's always been, hard to house folks who were undocumented, immigrants who were documented just as hard as everyone else, but undocumented. And really, in the communities I serve, the faith communities really stepped up and done things that we are unable to do, right? That we are. Give examples. So, like safe parking, programs, like, food and even shelter without it being called shelter. Like, I have my partners that I call, they're like, hey, I have this woman at my door. I can't serve them. They're nowhere on we use what's called coordinated entry, so they're not going to actually rise to the level. Can you help them? And their congregations. So really, I'm talking person-to-person, community-based help, right? So our faith community has been wonderful, and often sometimes like the federal government's pitting sort of nonprofits against faith community, no, we are partners in caring about our broader community. So I think that's a huge one.
Yeah, we've had a great partnership with CityServe. Especially through Vineyard, we really have reached out to them when we have needed to connect folks to services. As I said, if we can help provide that stabilization around food and temporary shelter, which I call the sort of amygdala piece, the prefrontal cortex piece, is working with organizations like CityServe. We are partnering together right now. We did not know we were partnering together, but we are, with Racetrack, with everything that's happening with the immigrant families out there, that what has sort of been uncovered with the conversation around the ending of the races there is probably decades and decades of under-resourced opportunities there is what we're finding. And so we're providing food to about 30 to 35 families. CityServe is doing case management, care coordination with those same 30 to 35 families. It doesn't change the situation there. There are harder things to still come for the community and families out there, but doing what we can right now to make sure that people are cared for to the best of our abilities to give them a chance to take those next steps is crucial. So this is a partnership that is working. So shout out to CityServe.
And thank you for also bringing up the racetrack, because I don't think people know about the racetrack. I don't think the press has gotten talked enough about it, but it's really important that all those families are served. Is there any collaboration?
I just wanted to mention about the racetrack. I mean, I've been with CAPE for 20 years, and many of our children have come from families of the racetrack, so it just lifts my heart to hear that City Serve and all those that are involved with that are finally taking a deep look at that, because that has been a very dangerous, kind of sad situation for families. And so I know that my colleagues that are here from CAPE are ecstatic to hear that as well. So thank you for that.
Can you elaborate a little bit on what that looks like?
So for us, some of the children that attend are on our Pleasanton site from the racetrack.
So can you tell people who don't know what the racetrack is, what the reference is?
So the Alameda County Fairground racetrack. And so one of the things that we do is we do home visits. And so we actually go out to our clients' homes and you know, just not to judge or anything like that, but just kind of see the situation, make that homeschool connection. And you know, back in the day, many years ago, actually my first year with CAPE, I went out to the racetrack. And you know, it was a pretty deplorable living situations for the immigrant community, hardworking immigrant community. And so, yeah, so it's a long time coming.
So I don't know how many of you know that, so that racetrack at Alameda County Fairgrounds has been shut down, and there are a large group of immigrants that were living there, that were taking care of the horses and living actually on the property. And now that that source of income is gone, they don't have anywhere to go. And I think the thing that upset me the most was I didn't even know that this was happening when they were there. And now that it's gotten even worse. And so I think it's really important that we speak about that. So in your experience, what's the most effective way to reach immigrant communities and ensure that they know support is available?
Yeah, I think being willing to stand up. You know, we already have interesting conversations with law enforcement as it relates to Vineyard Resource Center, and that, you know, when it comes to principles, we are not unambiguous about where we stand in terms of believing that people should have access to basic human rights, and that's a non-negotiable. And so when it comes to investigations, whether it's local law enforcement or it's ICE, outside of judicial warrants and those types of things that we do have to comply with, we are going to remain neutral when it comes to investigations. We're going to protect people. We're going to protect people's information. We are not going to make this easier. I think there is this false dichotomy of we're either a nation of laws or a nation of immigration. We are both, and we have to find a way to live in that middle space. But as a provider, I think people need to know that there are places that they can go, and that there are people that they can trust, that have their backs, that are not going to cave when it gets hard. And so the more we can create that culture wherever we are for each of our organizations, I think the better people are served, and I think our communities are stronger as a result of that. But we as nonprofit providers have to be willing to stand up and do that work, especially when it's hard.
Yeah, I mean, I agree. Like, really specifically, I think we need to serve people where they already go without the stigma. So that's why, you know, starting with food programs. Like, everyone can sort of get behind of feeding families, right? You know, like, so like, go there because there's a stigma within immigrant groups on going to mental health services or even asking for housing services or getting any sort of benefits, right? But the first place that we see people often, you know, on the edge, like many that even aren't homeless yet, that are just struggling to survive, is in food programs. Schools is the other one that, you know, that you know, we need to have better eyes and, you know, teachers and whatever, and give access. And, you know, again, it's a regular, you know, education, a regular feature of everyday life. So it's not, again, othering folks. So I think those are the places that we need to really be doing more and more outreach, because people are already there, and it's not without that stigma of them having to go somewhere else. else. It's already hard enough for these households to go from place to place to place. Let's go to them where they're already accessing services, even if it's an entry in.
So if I'm understanding you correctly, that you're saying that there's not as much stigma now with food insecurity as there used to be. And so
in mental health, as there in accessing other public benefits, as there is, and even healthcare. You know, healthcare is a little easier in, like if we can like help someone with a flu shot, and then, you know, offer other things, that's a little easier otherwise.
So bringing the resources to the food banks is
right.
So, great.
Yeah, I think that was the idea behind Vineyard, right? To create a place where people would come, find that sense of community there, but also have access in one location. And obviously there are lots of things that aren't represented in Vineyard, but there are a lot of things that are. And so, to put those at a place where people are already going to come, that was the whole idea behind Vineyard, right? But we're not asking people's immigration status to eat. We're not asking people's immigration status to get connected to CalFresh, or Access Community Health, or City Serve, or Partners for Change, or Tri-Valley Career Center, Tri-Valley Haven. We're not asking people's immigration status to stay in a shelter. I mean, these are just things that people should have access to, and that's a bell that we need to continue to ring.
Yeah, I think, what we're doing today, I think the collaboration, we partner with many of the people in this room, and I think, we need to continue to do that. We need to continue to be a voice and a presence, and, providing services, where folks are at, for us is very helpful. We have family advocates who work with families, all families, to make sure they have all the resources that they can possibly have. We have a lot of resources in the Tri-Valley, we just gotta use them. Make sure they're being utilized, as much as they can.
The final question is going to be like, what can community members do to assist the organizations or immigrant community? So we're going to get to that. But I wanted to take a minute and just open it up for questions right now to see if anybody has anything.
I'm going to stand up. I just wanted to thank you all for presenting today. I'm actually an undocumented individual in the community as well, which is really interesting, kind of being like in my perspective and then hearing you all like talk about this. I'm also part of a nonprofit, so that's the reason why I'm here. But I think one of the things I want to ask you in your organization is, how do you bring in cultural humility? Because I think one thing that I noticed, and I've experienced this myself too, when I go with people, where you go into like a food bank and either people don't speak Spanish or they're just very nonchalant about your presence there, right? And I just experienced this like this week with a person that didn't speak Spanish, and I was like, donating food, and he was like, hey, like, can you help me? And I was like, of course I can help you, like, I speak Spanish, I speak English. But then when you're speaking to the people there, and I'm assuming they were volunteers, they were very disrespectful and rude, right? So it's like, how do you guys bring in the cultural humility where people come into your space and they're like, oh, like, there's somebody who at least speaks Spanish, right? There's somebody who will understand me and understands like the community and like where I'm coming from.
Yes.
I think that's a very important question. I know that we've had some people talk about, it's not just the Hispanic community, but it's people who start speaking Mandarin who go to a food bank and they don't have the food that they want, or they don't have someone that speaks Mandarin, and it tends to be elderly people. So.
Well, for us, one of the things that we do is that, depending on the home language of the child, we always make sure that there's at least one teacher in the classroom who speaks that language. I think that is so important for any organization, to have lots of different speakers, whether it's English, Spanish, but that's something that we do. And one of the things is that, if our parents need translation services, we will provide that for them. It's very, very important that they have that connection. And so that is a great question, because I think when you go into a space and you're already feeling very vulnerable, it's so important to have somebody that you can connect with.
I'll say this is a really hard question, and I really appreciate it that, you know, in our organization we have cultural humility training and all of that. We also encourage people with multiple language abilities that, you know, we pay them more. Like, there's a process because, you know, that's a gift that they're giving us and the community that we serve. So acknowledging that not as, you know, not as something else. And what you say is really true. Then we also want to bring in the volunteers and rely on community. And there's just a limited ability to do all of that training and support and all of that with every volunteer we bring in. So we do our best, I think, right? And then we make sure that we have staff on site to course correct in real time if we see, you know, something not respectful, you know, coming in. We also have policies in our organization of not actually letting teenagers volunteer with directly with the participants, honestly, because they might be the same teenagers in their own schools, right? You know, so it's not that I have 2 teenagers myself. It's not like they're awful human beings, but it's really, usually there are some, but girls, mine too. Anyway, so that's a whole different panel. But, you know, but it's just like, how does it feel on the other side? Because we have young people, you know, in our sites and our shelters too. If, oh, that person goes to my school, right? You know, like that's a violation. So we just are really mindful and thinking about how, you know, how that plays out in, you know, in our whole population, immigrant and others. So, but it's never perfect. You know, I think it's like approaching things with a curiosity and a humility. Like it's just like, hey, I don't know, asking questions instead of assuming. Those are sort of the basics that we teach everyone, so that we're not just overlaying our own cultural being onto someone else.
Yes, thank you for that question. I think this is never a box that will ever get fully checked where we can say we have 100% accomplished that. We have no room to grow in that. I think for me, it has a lot to do with when we speak about cultural humility around the language we use and the frames we use to talk about it. A lot of times around, you know, cultural humility relates to language. We often hear about language barriers or language challenges, which I think we should replace those with, you know, not barriers to or challenges to, but opportunities for. These are opportunities for us to serve more people and to serve them better. And so for us, when we don't have staff on site that maybe do speak Spanish, and that's something that we are very much committed to when we're looking at who we want to hire, is who are we trying to reach, and being able to speak in someone's native language is amazing, right? And there are things lost in translation when that doesn't exist. And so in the absence of that, we use an organization called Bruce Lingo, which gives us great access to a translator in real time and actual human voice. I'm not throwing any shade to Google Translate, or Translator, right? In a pinch, right? I've used that, others have used that. Printing our menus in different languages has been huge, right? Especially for our senior middle clients. The Tri-Valley is a very diverse place, as we saw from our first presenter. And so, you know, menus, you know, printed in Spanish, printed in Cantonese, Mandarin, Korean, to start, for example. I think on the food side for us, with Open Heart Food Bank, and Alameda County Food Bank is doing a great job of this, of talking about culturally sensitive, culturally relevant food, of not just providing food and shoving that towards people and saying, hey, you should be grateful, here's a produce box, you know, you get what you get, you don't throw a fit, which has often been the sort of MO of food banks, right? Of saying what kind of food would be most meaningful for you. And we will do everything in our power to source that food, to make sure that you're getting food, not only that is nutritious and sustains you, but means something when you make it, right? It connects people to their history, connects people to their family, connects people to their community. And so those are small, those feel like small things sometimes, that added up over a length of time, pack a big punch, I think. I think a diverse staff, I think diverse boards, I think diverse volunteers, I think training around, can I say it, diversity, equity, inclusion. equity, inclusion, belonging. I said it, right? These are strengths, not weaknesses. We should be shouting this louder, but representation matters. And so having people see themselves reflected in the people that are also doing the service, that are volunteering, and then inviting them into that service as well to serve the larger community is important. So, and there's an individual piece to this. There's not just the organizational work that we do with retreats and workshops around this, but there's an individual stake. We all need to be doing this individual work too, sort of figuring out where we're the problem, where we're the drama in this, and we're not actually being helpful, and never letting our foot off in that pedal of growing and developing as individuals as well.
You remind me of one last thing of, we've changed the frame of what's easier for us to what's easier for the people that we serve. So even, it used to be that if someone was monolingual, then we would really use postlingual and find a staff. But now we always ask, what language do you prefer to speak in? Because we have a lot of folks who speak English and another language and prefer to speak that other language. So even though it's easier for us because we have more English-speaking staff than name the other language, we always start there so that we are speaking to them in the language they prefer, not what's easier for us.
So we've talked a lot about the Latinx community. Is there another community that you see growing really fast that our providers should be prepared for?
Yeah, I mean, I think for our Asian and Southeast Asian population especially, when I look at just our senior demographic for our pop-up pantries and folks that are coming to our senior meal sites, Livermore and Pleasant and Dublin are very similar, but they're also very different. And so Dublin, for example, definitely has greater representation of the Asian community, and also the pop-up pantry we do in Dublin. To a lesser extent Pleasant, and to a lesser extent Livermore. But that's where I see that community growing rapidly in the community. And there are some cultural pieces that we're learning to do that work better.
For us, no, we really see, in homelessness, and the homeless count in the Tri-Valley area, we see Asian populations underrepresented in the homeless count, meaning, relative to the general population, there are far fewer homeless, and we see growing still. The Latinx community is one of the fastest growing subpopulations in homelessness. So really, we are, looking at this maybe in the future, we see more and more as threats of deportation, as threats of other federal policies that are going to hit harder our immigrant communities, like the mixed status rule that is likely came in the first administration, but this is basically for all of the housing authority vouchers, any of the Section 8 housing choice vouchers. You might know that currently really allows mixed status households. Someone has to be eligible, have documentation, but others don't have to. That might change that rule. That will displace many households, hundreds of thousands across the country, if that happens. Lots and lots of children, because in some of those households, the children are the ones that qualify and the parents might not. So, and they qualify now under the mixed status rule, they will likely not.
Have you had any funding cut as a result recently? I know there's lots of threats to it, but has there actually been any cuts yet?
We're federally funded under the Health and Human Services, so you guys know the news right now, it's pretty volatile. But we haven't had any funding cut. What we did, because they're not providing any COLA increases for our staff, so I think that's a cut. It's definitely a cut. So they're calling it flat funding. We, under Mr. Kennedy, he's making a lot of changes very quickly. We just submitted our grant last week. We just lost our Office of Head Start Specialist. He got cut. And so really we're kind of up in the air. We're waiting to see what happens with our grant submittal. It's not a guarantee. So
So we're about a third of federal funding, but it doesn't really matter because we're largely government funded, so it just comes through other mechanisms. So we're all waiting to see what happens with Medi-Cal, right? So, because if that happens, all of the cities, counties are gonna have to backfill like hospitals and like really essential services like that. For us, we have, the only thing that we've gotten, I guess, cut is we've been recommended for award for something we applied for, but then they said, oh, we actually can't fund it because of the federal government. It's tied in with FEMA, and it's actually for food, right? But nonetheless, that's sort of on hold, not necessarily cut, but we're waiting. The other thing that's happened is all of our HUD agreements for to help maintain people in housing. So most of our HUD contracts are to get people in housing and then pay their rent and provide services, to that. We've gained those awards, but they're coming with really, really, really ugly language that basically require us to follow every executive order ever, right? So including race, gender, immigration, all of that. So we're at a crossroads right now. Like if we sign it, then people stay in housing, and we put our personal morality, values, all of the things that we care about in jeopardy. But if we don't, then that money doesn't go to the people that were homeless before we house them, and will become homeless again because that's paying for their housing. And so we're at that crossroads right now.
So we have a little over $500,000 in funds that support mostly the senior meal program, but also the community meal and the overnight shelter. We were also the recipient of one of those community project funds that we co-wrote with the city of Livermore last year. And we were all assured that no matter who was elected president, that money just had to be voted on this year. Well, that got pulled on March 15th when the continuing resolution passed to avert the government shutdown. So we lost $850,000 for open our food banks operations.
So as you know, we've got our choir here. So what would you tell them as members of the community, and I see we have some elected officials here too, do to assist your organizations in our immigrant community? So we want people to walk out of this room feeling empowered and feeling like there's something that they can do and how that they can help. And this is our last question.
I'll start, I guess. So what I'll say is try not to become paralyzed with all of the federal craziness. Like we feel so out of control all of the time because we're like, how can we stop this maniac, right? But, he who shall not be named. But I'd say there's a lot of things locally, and I would say beyond it doesn't have to have immigration or in the word. Like think through the policies that your local folks are putting forward and how they're going to impact the communities you care about. I will take something that's near and dear to my heart. That there's a recent climb in the criminalization of homelessness. So bans on people living outside in RVs, that sort of thing. Think through how that impacts the immigrant community. I was talking to a young man, probably my age, a gentleman that is living in an RV, and he, now it's already horrible. He has a full-time job. Works as a maintenance tech, and he just can't afford rent, right? And now he's in a city that police are literally can arrest him at any point in time. And what does that mean for him, right? What does that mean, like the fear that he's living with beyond just the fear of all of the other things of living, in an unsheltered environment is. So think about those sort of policies as your local government is putting them up, how it impacts all of the community that we serve, not just sort of solving a problem that looks like it's for economic prosperity, helping businesses. Really, it's look at how we all work together as an entire community.
I would, definitely just encourage everybody to continue these kind of collaborations, definitely. But also, I have to agree, not getting caught up in all the political rhetoric, because that will take you down very quickly. There's so much coming across right now that it's really difficult to stay away from it, but we have to, because we have so much work to do, to keep all of our programs running and going forward. I think that's what's most important. I think that, we have to stop the madness within our own community and stay laser focused on, what our goals are, and that is to support immigrant families, all families that are suffering hardships in our communities. We just have to stay focused despite everything. I think that's advice I can give. It's not going to stop for a while, but we have each other, and we're all on the same playing field here when it comes to serving families. And I think that's what we have to remember, is that we have each other, doing heartfelt work, serving our communities.
Yeah, and I would just say, you already know this, just resist the intentional whitewashing of history that's happening right now. And I would, I felt convicted and challenged by the first speaker. How many undocumented folks do I know that I could say, if something happens, I will take care of your child? Right? So who do I know, and why? If I don't know someone who's undocumented, why is that? In my own bubble. So get out of your bubble, I would say, and don't just talk the good game, but actually have some skin in the game.
Well, I know this weekend there's a lot of protests, peaceful protests planned across the country. One I know is taking place in Livermore. Is it 11 to 12:30?
12 to 1.
Or 12 to 1:30?
1:30.
12 to 1:30 at downtown.
Noon, San Ramon City Hall.
And noon, San Ramon City Hall, all over. I went to a talk by Van Jones this week. It really impacted me. And he talked a lot about really having to work with love, with everybody, not just the people I agree with. And so that's my big challenge, is how do I see people as worthy? Because I don't know about you, but my first response is always like, they don't count. That's what he was talking about. And really having to see every person as a valuable human. And this situation is going to be solved with love, not with division. And so that's my big challenge. And I would like to thank our, can you come up, it's Sylvia, right? Am I getting that right? I'm Lydia. I don't know why Sylvia, I got named Sylvia when I was a girl. Lydia and Julia, can you come up here so that we can thank you? We have little gifts. And I also wanted to see if you had one thing that you would share.
Well, thank you. I'm just so grateful that it's been such a privilege to be a part of such a wonderful group of speakers. And I've learned a lot, and I also have a lot of hope after hearing this discussion, because I know that there are a lot of people working to do what we can. I think what I would say is, like, you can see that there's something that each of us can do, right? And like, we might hear hate and we might see hateful policies, but that means that we just need to speak more loudly with messages of inclusion and support. We need to think about our programs and how we target them and how we consider the populations that are being disproportionately affected, our immigrant populations. And how do we think about how every program is serving them differently in this different context. There's a lot that each of us can do, and it's really nice to hear about the work that so many are doing here in this community.
Thank you. It's been such a pleasure to be here today. It's a pleasure to know that you all exist, because I actually didn't know about this before coming here today. So I think for me, it's just like being able to be connected within our local community is really important, and pooling our resources and supporting each other. So I hope to now be considered part of your community and you all part of mine, and to be able to maximize our impact through working together.
So we have a couple of thank you gifts. So these are for our speakers, for the panel. So thank you very much. Thank you. Thank you. And I want to thank all of you for coming out, and stick around and ask a few questions if you'd like. Thank you very much, panel.